I'm Genoa Barrow, senior staff writer of the Sacramento Observer. I'm a strong believer that our health is our wealth, and as part of our continued coverage on working toward better health outcomes, I'm excited to be here today with Dr. Monica Soni, who is the Chief Medical Officer and Chief Deputy Executive Director of Cover California. First, Dr. Soni, thank you for joining us and sharing insights with us.
Thank you so much for having me.
Yes, and we have this unique opportunity to talk to one of our leaders is making change here in California. Can you start by telling us a little bit about who you are and how you came to this work?
Yes, well, you got it. I'm the Chief Medical Officer right now at Covered California, which is the largest state-based marketplace in the nation. And I'm also a practicing primary care doctor. So I've spent my career thinking about how to keep the folks across the table from me healthy and well. And I have the opportunity to now do that at scale for my fellow Californians.
And Cover California was created out of the Affordable Care Act, which, as you know, people still lovingly refer to as Obamacare.
Right.
Can you clarify what Cover California is and isn't really?
Yeah, absolutely. So you got it right. The Affordable Care Act created a few different provisions, one of which was expand the Medicaid or giving states the option to expand Medicaid. The other one was creating the state-based marketplaces and the federal marketplaces. So this was really closing an important gap for folks. If you did not qualify for Medi-Cal or Medicaid based on your income, if you were too young for Medicare or you did not have employer-sponsored coverage, you really were out of luck. And also, people were being excluded for having pre-existing conditions. All of that changed with the Affordable Care Act. And so Cover California was born over a decade ago. And we are now lucky enough to be able to serve nearly 2 million Californians right now across the state, from the top all the way down to the tip, in getting high quality, affordable coverage.
Wonderful. And how would you describe the current state of health coverage in California and the role Cover California has played in connecting people to healthcare?
Yes. I think it's easy in these times to have a little bit of doom and gloom. And so I love this question because we get the chance to really celebrate the progress that we've made. When you go back to before the Affordable Care Act, we had over 17% of Californians uninsured. Over 17%. We're a big state. That's a lot of, those are millions of people.
Yeah.
And over the last decade, we've been able to reduce the uninsured rate to under 6%. And those gains, frankly, disproportionately impacted communities of color. It impacted Latino, Black folks more. We had higher rates of uninsurance down to where we are now. So it's been really, really substantial. And I'll say it's not just about, having an insurance card in your pocket. We know that actually there have been mortality gains with the Affordable Care Act, particularly on the Medicaid side. States that expanded, on average life expectancy went up. We had more screenings. We caught more cancers. We do more substance use disorder treatment. Infant mortality has gone down. So just a lot of positive progress.
So one of your goals is to simplify the complexity of health coverage and empower people to make informed choices. Why does health coverage still seem, or feel complicated for so many Californians?
Well, I think they're not wrong. It's not just that it feels complicated. It is really a complicated process. What you're eligible for, is your family eligible for, what your income gives you, what your employer gives you. The rules are actually different depending on where you get your insurance coverage. And so I think one of the aims of Cover California is, frankly, to meet people where they are and to try to simplify it as much as possible. I do think part of why it's so complicated is because in the United States, we've made a choice that different people pay for your insurance and your coverage depending on where you are in your life. So you age into Medicare, your employer is responsible if you're working. And then if you're low income, we have other options. And then, of course, as we talked about, we had this critical gap where if you were an individual who was unable to get coverage from one of those other sources, you were sort of on your own before the marketplaces existed. So again, it's still a complicated landscape. I think we do our part to try to make it as simple as possible. We have sort of a open door policy. If you come to us, we will help you find your coverage option. Doesn't have to be with us, can be with Medi-Cal, can be in another pathway. For us, as long as you're insured, that's a win. We're not an insurance company. We're just Californians fighting for other Californians.
Sure. Is that for some folks, as you know, as a medical doctor, the emergency room is still, their primary care provider. Can you talk about the importance of consistent coverage?
Yes. And this is actually a very concerning statistic. When you look across the nation and in California, the number of folks that say they have a usual source of care, someone that they always go to get their needs met, continues to go down. Most people, would benefit from having a regular relationship with a primary care provider. I am biased. I am a primary care provider, but I do think the studies suggest that if you have someone who knows you, cares about you, your mortality actually goes down, excuse me. You have better chronic disease control, you better experience, and actually your cost to the system also goes down because you're not going to the emergency room and you're not going to the hospital instead because of, uncontrolled conditions. The truth is that we do have an impacted workforce. We don't have as many primary care providers as we should, and we have a very sort of siloed and fractured system. So even the primary care providers we do have don't necessarily accept all insurance types, and so that makes it hard for folks. But I do think that true north is that each of us has a primary care provider who knows us, cares about us, and understands when we have a need that needs to be met from a health perspective.
Thank you. Let me ask you, due to, the historic medical, due to a history of medical mistreatment and systemic inequities, many African Americans, still hold a deep-seated distrust of the medical community. How does trust or the lack thereof impact whether people stay connected, seek care, and stay covered?
Trust is a critical factor. And I might rephrase it to say, it's less do we need everyone to be trusting and more are our institutions trustworthy? Are we deserving of trust of the folks that we serve? And I think, unfortunately, both the government and medical institutions and research and academia have not always been trustworthy institutions and have caused harm, especially to Black folks, but to many other folks as well. And that history is not old history.
Yeah,
right?
There's things still going on.
Still going on. And we're talking about recent history, folks that are alive today that had harm from many of these systems. So I do think the onus is on us, right? I'm a government employee. I'm the primary care provider. I work in clinical environments. We have to make sure that we're trustworthy institutions. And I think a critical first step is, are we listening? Are we talking? Are we engaging with folks? Are we taking the feedback? Are we taking that feedback and turning it into action for folks? And so I think there's lots to be done. I think Covered California, again, maybe I'm biased, is really an institution that takes this very seriously. In our mission statement, we had reducing health disparities. We have equity baked into everything we do is really in our DNA. And so I do think we're a potential example for how do you try to be trustworthy and course correct.
And let's talk about health equity. What does that mean to you, and how do you go about achieving that in the space that you're in now?
Yes. For me, it's what you talked about, these structural issues, the history. How do we help build a system that keeps us all healthy and well, or helps us get healthy and well? And so, I spend most of my day in and day out actually thinking about how to make that come to reality. So one big pillar I'll say is data, right? We have one of the richest data systems in the US. We share our backend data system with Medi-Cal. So you can imagine that's, millions and millions of Californians who have opted in to tell us, how do they identify themselves from a race and ethnicity perspective? What language do they prefer to speak in? What language do they prefer to be written in? We can take all of those demographic data and pair it with real health outcomes data because we have claims from our health plans. And so right now, if you were to go online, you could see, for Black women in Sacramento, what's the rate of breast cancer screening for Covered California enrollees? For Vietnamese men, in San Diego, what is the behavioral health utilization for them? It's that level of specificity and granularity that we try to bring forward and be very transparent about. And then when we see that there's underperformance or opportunities for improvement, you really take that back to the community and say, help us solve for this, help co-create with us. We believe that the knowledge doesn't come from us. It really comes from those that we're trying to serve. And so it's about taking those data insights and turning them into action.
Okay. And then let me ask you this. Of late, there's been a lot of, pushback on, equity programs, programs that are, seemingly have been making progress on, addressing some of the disparities that have, impacted Black people for, quite some time. How is Covered California sort of, mitigating some of that the impact of that?
Yes. Well, maybe I'll start with, I am the first Black chief medical officer at Covered California. I run a division that is the Health Equity and Quality Transformation Division for California's Obamacare. It's hard to have a smaller target than what I currently have right now. And so I feel extremely proud that our institution has not backed down. We have not retracted from the work. It's part of our mission statement. It remains in our mission statement. And there really is no way to take care of Californians and deliver on our vision to improve the health of all Californians if you aren't doing it in an equitable way. There's no quality without equity. That's something we say all the time. And so, frankly, the work continues, right? California is committed to this. It's important to us. It's resourced, and we continue to put one foot in front of the other.
And a lot of folks are concerned, with, the ending of programs, funding, premiums going up. Isn't that like next month? Can you talk a little bit about how, can you put people's minds at ease or?
Yes. Well, can I put people's minds at ease? Maybe. I mean, I think I can give information and I can certainly share what is California and Covered California doing in this moment to face the moment. So one, absolutely, there's been impacts from the, federal administration and policy changes. The, so-called the Beautiful Bill or HR1 has a lot of really impactful changes on the health side. And then we're in the middle, or we just ended a government shutdown in part because of enhanced premium tax credits. So let me talk through a little bit of what came from both of those pieces and the impacts on us and others. So one is, there were pretty substantial changes to some of the eligibility and enrollment criteria. So I would simplify that as saying more red tape and less support, particularly for certain populations. So all of that kind of came through the federal administration. I will say there have been some legal challenges to some pieces of that. So some pieces, there's sort of a stay, and it's not all going into place immediately. But the intent was, essentially more red tape for many folks to be able to get coverage. At the same time, that happened on the Medicaid side. It happened at the same time to SNAP programs or CalFresh in California. So you really have three big programs that impact millions of Californians, all with additional potential barriers to accessing care. The enhanced premium tax credits is sort of a separate issue. Over 90% of all of the 2 million folks that we cover on Covered California get some form of financial assistance. And we're talking about folks that might pay $0 a month or $10 a month for premiums. And we were able to braid funding together. And for this year, we actually eliminated deductibles for over 1 million Californians. That's better than many people employer funds for coverage. Yeah.
Sign me up.
Well, exactly. And so we've been moving towards more and more affordability, and particularly for our lower income folks. The enhanced premium tax credits are a critical part of that. They were set to expire in December of 2025, so this year. And that's partly why the government shut down, right, is that we didn't have Congress coming to agreement on what to do about them. Do you extend them? Do you not extend them? Well, we're in the middle of open enrollment right now. And open enrollment lasts until January 31st. We have folks having to make decisions right now about do they continue or do they not? And right now they have to make a decision assuming that the enhanced premium tax credits do go away at the end of this year. That is on average a 97% increase in premiums from December to January. This is just days, right? One paycheck to another, a 97% increase in premiums. And for communities of color, for our Black and brown folks, it's more than that. This is something that disproportionately impacts Black folks in the wrong direction. So it's super tough. Our estimates are that, maybe 400,000 people would go uninsured off of just Covered California alone, let alone the 3.5 million on the Medi-Cal side that might go uninsured in 2027 when those restrictions kick in. We're talking about millions of people across the state of California who might go uninsured and without food if the SNAP, changes really go into place in the same way in 2027. It's a tough time. So I don't know if that was very real.
No, yeah.
I don't know if that was
reassuring.
People's minds at ease.
So, can Covered California stand in those the gaps for people?
Yes, we can to a certain degree. So we received about $2.5 billion in the form of those enhanced premium tax credits as a state. And I'm very grateful. I mean, we were able to get $190 million from the state of California to try to close some of the gap. And we'll use that to reduce premiums, especially for our lower income folks. But the math doesn't add up, right? 190 million, 2.5 billion. We will still have a gap that we cannot close. And so I'll say our marketplace is much, much more stable than other states, but it's, it's really still a challenging set of circumstances right now.
Let me ask you, you talk about the marketplace, and we talk about, the importance of, culturally competent care. Does Cover California, make a concerted effort to make sure, doctors of color such as yourself are included as an option for folks?
Very much so. I mean, this is a very important part. And I like to say that it's not about preferences, right? Like, yeah, I prefer to see a doctor that looks like me. Mm-hmm. That's just true.
Or understands, what I'm going through.
My experience, totally. If I can't find someone that looks like me. But that's not just about preference. The studies actually show that, especially for Black folk, when we have concordant care, our outcomes are better. We live longer, actually, if in the density of our neighborhoods, we have sort of equal or higher density of Black physicians too and Black clinicians. That's like a life extending measure for us. So it's not just about preference. And so we have a number of interventions in this space. One is that when the Affordable Care Act was created, there was an expectation that we would still include in network those docs that had been taking care of folks in community and of community. So we have a whole branch of our work, which is making sure that what we call essential community providers are available to the folks that we support across the exchange. So that's one piece, making sure our plans are contracting with those providers who are in community and of community. But we know there's not enough. And so I do think from our seat, we think a lot about what can we do as what we call an active purchaser to increase the pipeline or the pathway of, clinicians and physicians, ancillary providers that reflect the diversity of California. And so, for the first time in 2026, we'll be using some funds from underperforming health plans to actually do pack away in pipeline programs and try to increase the number of folks that are going into health professions. I don't think most purchasers are doing things like that. I think we don't believe in staying in our lane. We think sort of everything's our lane if it impacts Californians and the health of Californians. So it's both like immediate interventions and then this more investment type intervention as well.
Our health is worth it. In closing, what message would you like to share with Black Californians and those here locally who are currently uninsured or underinsured about the value of Cover California?
Yes. We're not an insurance company. We are here, Californians fighting for other Californians. A full-time job is to think about how to make sure, especially, Black Californians are getting the care that they need and deserve. And so I would say, rather than to listen to some of the swirl that's out there, come to coveredca.com, call us. We also have navigators, 14,000 across the state of California in community who will just talk with you about what your choices are. Come and get the information for yourself and then make an informed decision about is it for you or not for you. We still will have financial support, especially for lower income folks. And so that's my message is like, just come and see what your options are. And we're here to help.
Thank you, Dr. Soning.
Thank you.
We appreciate it.